Thank you for joining today to learn about the IPRO Hospital Quality Improvement Contract Initiative, otherwise known as HQIC. I'm Michelle Norcross, the HQIC Director for Superior Health, and I'm overseeing the work in Michigan, Minnesota, and Wisconsin. We are so glad to have you engage in the IPRO HQIC. Under this HQIC, you'll have the opportunity to leverage innovation across a wide geographic region and will support your hospital in reducing all-cause harm. Under the IPRO HQIC, there are many experienced partners that bring diversity, expertise, and resources and include quality improvement organizations, or QIOs, established hospital associations and previous HINs, and national experts in person and family engagement. The IPRO HQIC includes 12 states. Listed on this slide are the subcontractors working with IPRO under this work. You and your hospital are working with Superior Health Quality Alliance, which covers Michigan, Minnesota, and Wisconsin. But you'll also have opportunities to engage across the entire network. As I shared on the previous slide, there are some wonderful organizations working on HQIC under IPRO. IPRO, Health-Centric Advisors, Clarent, and Superior Health have all worked on QuinnQIO efforts. Kentucky Hospital Association, Q3 Health Innovation Partners, and Superior Health have all worked under the HIN and HEN efforts. And Clarent and American Institutes for Research, otherwise known as AIR, were both support contractors for CMS in past quality improvement efforts. By engaging under IPRO for the HQIC work, we will offer your organization technical support at no cost. This includes data analytics and benchmarking, data dashboards, including ones to engage your board of directors, your Person and Family Advisory Council, or PFAC, and your staff in quality improvement. You'll have the opportunity to participate in the ARC Culture of Safety Survey and will provide hospitals with individual and benchmarking survey results. You'll be able to participate in patient safety learning collaboratives and learning and action networks. You will have access to patient safety resources and tools, including an entire resource library with resources by topic and area of harm. You'll have the opportunity to engage in a peer-to-peer sharing platform through our online community, and you'll have access to person and family engagement metric coaching through our nationally recognized experts, AIR. In addition, you'll have access to subject matter expertise. The local support you know, combined with an expansive group of SMEs from across our collective states, will be able to assist your organization in driving meaningful improvement. Superior Health will offer you one-on-one technical assistance on any of the 8 core areas of harm or on COVID-19 planning and response. I'd also like to note that IPRO has an HQIC-wide PFAC, of which you can recommend a PFAC advisor to participate on and provide meaningful feedback of what would be most helpful to your organization. We also will have opportunities for participating hospitals to provide input on new tools and resources in development. As you can see, there are a lot of ways in which your organization can engage. We ask that you participate in opportunities that are meaningful to you and your organization and can help you drive improvement. You may wish to engage in areas you have opportunities for improvement, or in areas that may align with your strategic goals. Or you may want to engage in everything, and that's perfectly okay. We are here to meet you where you are and be a resource to you and your hospital. Under the HQIC, we'll be focusing on 8 core areas of harm, which include opioid stewardship and behavioral health, adverse drug events related to opioids, anticoagulants, and glycemic control, catheter-associated urinary tract infections, or CAUTIs, central line-associated bloodstream infections, or CLABSIs, C. diff, MRSA, and overall antibiotic stewardship, sepsis and septic shock, pressure ulcer injuries, and readmissions and care transitions. Our goal is to help augment your existing patient safety processes and support your hospital in reducing all-cause harm in these areas. You'll also have the opportunity to engage in optional patient safety focus areas, including surgical site infections, or SSIs, venous thromboembolisms, or VTEs, ventilator-associated events, or VAEs, airway safety, and diagnostic errors related to timeliness. There will be goals and measures for each of these core harm areas, most of which will be collected through Administrative Claims, or NHSN. Your Quality Improvement Advisor, or QIA, will provide you with a list of goals and measures of which you will be working on over the course of the HQIC program. Together, we'll be working to improve behavioral health outcomes with a focus on decreased opioid misuse, increase patient safety with a focus on reduction of harm, and increase the quality of care transitions with a focus on high utilizers in an effort to improve overall utilization. These are the current overarching goals that we will be working towards as an HQIC, and as you can see, there are sub-goals listed under each of the primary goals. It's important to remember that these are HQIC level goals, thus all of the hospitals recruited will be working together to drive this improvement. Your QIA will be able to share more information about the specific measures and will be collected during HQIC. The majority of these measures will be captured through existing data resources, as I've already listed, such as administrative claims and NHSN. There will be a limited number of manual entry measures, including those for person and family engagement, which I'll discuss on the next slide. As noted before, AIR, our subject matter experts in person and family engagement, will be available to assist you in implementing PFE best practices and to address barriers. The HQIC will be focusing on 5 goals for person and family engagement, including, first, implementing a planning checklist for planned admissions. And if you're a hospital with no planned admissions, you are not expected to implement this goal, but we will need to be notified that you do not have planned admissions. Second, implementing a discharge planning checklist. Many of you did this work during the HIN. Third, conducting shift change huddles and bedside reporting with patients and families. Fourth, designating an accountable and responsible hospital PFE leader. Fifth, activating committees in which patients are represented. This data was initially captured during your hospital baseline assessment. Your QIA will work with you to know how to enter this data as you progress on these metrics and where this can be entered. Health equity will play an integral role in the IPRO HQIC. Health equity will be included in our data analytics stratification, technical assistance, and learnings. We'll provide opportunities to share best practices, and we'll seek those out with a health equity lens across all of our networks. We know many of our hospitals are doing fantastic work in health equity and around topics such as food insecurity, transportation, and LGBTQIA+ inclusion. We hope to be able to celebrate this work and share these practices across the HQIC community. Participating hospitals will specifically need to focus on collecting race, ethnicity, age, and language, otherwise known as real data, and improving consistency and accuracy if it's already captured. Identifying health disparities in the HQIC patient safety focus areas, thus looking at how health disparities may be impacting rates of harm or readmissions. Closing identified disparate gaps in care or outcomes. And finally, engaging patients and families in all aspects of health disparities reduction work. And this includes ensuring those patients and families you engage mirror your community and are diverse and inclusive. We are so excited to be able to work with you in your hospital. We look forward to being able to connect with you soon if we haven't already been in contact. Each state has designated QIAs that will help you connect as your point of contact throughout the HQIC. You'll have an opportunity to connect with these quality improvement advisors for a regular touch point or one-on-one on the frequency of your choosing, and they will work with you to schedule these meetings. This will be a great opportunity for you to connect, learn more about HQIC and upcoming offerings, speak about your data, share the work you're currently focusing on, and obtain any help or support that you need. Included on the slide is the Superior Health Quality Alliance core team and those that you will most often be interacting with. As I shared, each state has specific quality improvement advisors, and I'd ask that you quickly take note of the person or persons you will most be engaging with. For Michigan hospitals, you'll engage with Christy. Minnesota hospitals will work with Jenny, Janelle, or Abby, and Wisconsin will connect with Jill. As the HQIC Director for Superior Health, you can certainly also contact me at any time. We look forward to connecting with you and driving some meaningful improvement during this contract.